Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about the alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. In our last show, we went to a local gym, and I interviewed several individuals about the benefits that they found through exercise. We interviewed a young lady with some disabilities, a middle-aged female professional, and we also spoke with several couples, elderly couples. Each one of them said basically the same thing, that exercise was a big part of their life, a part that made a significant difference in how they felt, how they looked, and in their mental state, and in their overall health. Each one gave credit to the fact that without exercise, they would not have been as healthy and have had a healthy lifestyle that each one of them enjoyed today. For me personally, this was my favorite show thus far because it demonstrated that we as individuals do have control over our health and our well-being, and that there is tremendous value in long-term health benefits if we just take a little time, get rid of the excuses, and move our bodies. These health benefits, both physical and mental, have a continual cumulative effect that can delay or maybe even stop the onset of many diseases. And that isn't that what every person truly desires, to live long and healthy? If you saw that show and you are currently not doing some sort of exercise or on some sort of program, I hope and pray that you will consider changing your lifestyle and think about becoming more fit and healthy. And if you have any questions whatsoever about how to start, just contact me. I will do my very best to assist you in obtaining better health. And speaking of health, let's define what I believe health really is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and the processes of the body. It is the harmony of the 12 systems in the body that allows the body to function in a healthy manner and hopefully prevent disease. Again, this show is designed to provide you with information that you can use to be better informed about achieving and maintaining your health. Many times there are alternative methods available for a given condition, and it is my desire to inform you about these treatments and therapies, as well as we all strive and seek better health.
We don't just do things bigger and better, but smarter and faster. We are pace setters, trend makers, caretakers. A community serving a greater community. Turning homegrown talent into a hometown workforce to be reckoned with. At HCC, we don't just keep Houston relevant. We prepare our students for success. HCC, smart decision.
It's exciting and bold, yet classy and comfortable. It's the Tom Felicia Home Collection that puts the finishing touches to your perfect living environment. James Craig Furnishings in Houston offers the Tom Felicia Home Collection, along with other fashion-forward home furnishings, fit for every lifestyle. They offer the designs you want and the service you deserve. Visit James Craig Furnishings.
Welcome back. Today in the news, we're first going to look at how drinking sodas can contribute to two significant life-changing diseases, diabetes and metabolic syndrome. According to a November 2010 study out of the Harvard School of Public Health, consumption of just 1 or 2 sugar-sweetened beverages per day is associated with a 26% greater risk of developing type 2 diabetes and a 20% increased risk of developing metabolic syndrome. Well, here we see again from another prestigious medical school that something that we can do to ourselves has a potential to cause a great deal of long-term harm and lead to a life-changing disease. Again, by eliminating our soda intake, we can cause a significant improvement in our long-term health. Our second news story has to do with funding of Medicare. And some of you may have already seen this in the news that many doctors are concerned about potential future payment cuts that's going to take effect in December and January of 2011. However, the head of the AMA, Dr. Cecil Wilson, MD, recently told Congress that many physicians are bound to close their doors to new Medicare patients to avoid closing their practices. According to Dr. Wilson, and I quote, "If Congress does not do something to block these cuts, Congress, are going to be putting health care and lives of senior citizens and the military families at grave risk." Let me repeat that, at grave risk, coming from the head of the AMA. So what does this mean? To you as a patient or to someone you love who's on Medicare, simply put, Congress has control of the purse strings and for the last several years has delayed these payment cuts to doctors, and now it has reached a point where if something isn't done permanently to fix the problem, many doctors will just simply quit and stop seeing Medicare patients. I bring this to your attention because the United States of America, we have the greatest healthcare system in the world. Does it need some improvements? Absolutely. But until Congress acts to provide a permanent fix to this payment issue, millions of patients on Medicare are at risk for not finding a doctor. I would encourage each of you watching me to make an effort, a special effort, to contact your local congressman and state senator and congressman at the federal level and have them take immediate and permanent action to stop this madness. And in doing so, provide all elderly Medicare patients with the stability and certainty of having a doctor to assist them with their health needs. We're going to take another short break, but when we return, we're going to be looking at an organ in your body that most people have never heard of, let alone know what it does, and how very important it is for your health. We will be discussing your adrenal glands and how, especially in today's stressful environment, many people are becoming very, very sick, and all because they don't know, and many allopathic doctors don't look at this simple organ to make sure that it is functioning properly. So stay tuned, and after a short break, I believe you will learn a great deal about better health.
We are united by more than just geography. We are a community within a community, essential to the common good. Locally driven and globally demanded. Proud of our diversity and focused on the future. HCC is the opportunity that leads to more opportunities. HCC. Smart decision.
Explore new worlds. Read. Visit literacy.gov.
Welcome back to Better Health. I'm Dr. Stowe. The first thing I want everyone in the viewing audience to think about is all of the different stresses that we live in each and every day here in the United States. Centuries ago, even decades ago, the primary worry or stress that most of us face was simply living. That is, where do we get our food, clothing, and shelter? You know, the basic things in life. Then, as we matured as a world, a country, even our society, and more modern conveniences became available, we turned from a society of basic needs to a society filled with wants. We want this fancy car, or this particular house in a neighborhood, or this particular vacation. I can remember back in the 70s when most people didn't even have a credit card. Only the wealthy were in the stock market, and according to some, times were more simple. But today, we are under constant 24/7 stress from a variety of directions for our time, our money, and our attention. Everywhere we turn, we are stressed. We are stressed about just everyday living. And for many people, it is causing diseases, and for some, it's killing them. It is also important to note that each one of us have our own stressors. Some people have plenty of money, but they have health concerns, while other people are extremely healthy, but they just lost their home in this very turbulent and tough economic time we're going through. The point is that each of us will have our own stressors that are unique to us individually. But before we go much further, let's define what stress is as defined by the Merriam-Webster Dictionary. It states that, and I quote, "Stress is any physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation." Now, for a quick second, I want everyone to read that last part again. May be a factor in disease causation. That stress can cause a disease? You bet it can. And in the next few minutes, I hope to be able to explain to you exactly how this happens. And of course, the main reason for understanding how stress can affect you is because once you know what a disease or how it is caused, then maybe there's something you can do about it to make a change and hopefully reduce your chances of getting a sickness or developing some sort of disease. So now let's turn to the adrenal glands themselves and see how and why these small glands sitting on top of the kidneys are so important. As you can see, the adrenal glands are pretty small. They only weigh about 5 grams or approximately 0.18 ounces, which is very small. But they are remarkable organs because of what they produce. The glands have an inside portion that produce hormones, primarily epinephrine and norepinephrine. Epinephrine primarily deals with increasing and decreasing blood pressure, while norepinephrine deals with more of the chemical transmissions needed for your nerves, both of which I would suggest are extremely important functions within the human body. The outer portion of the adrenal glands produces approximately 30 steroid hormones, but the primary hormone we're going to talk about is cortisol. All of the hormones are vital to health, but today's show is going to focus on cortisol. I want you to see how just one hormone can have such a dramatic effect on the body and how sick someone can become with a non-functioning adrenal output. And I want you to look at the screen. This is just a partial list of what cortisol affects and some of the areas within your body that are directly affected by a non-functioning adrenal gland with too much or too little cortisol being produced. Here we have cortisol and its influences that it can burn fat and have an effect on inflammation. Here's actually how the HPA axis, as it's called, works. The HPA stands for hypothalamus, adrenal, pituitary, and then the adrenal gland. What happens is we have stress that comes in and tells the hypothalamus it needs something to do. It's got to affect us. If you've ever been in a car and a police officer's pulled you over, you've got sweaty palms, your eyes have dilated, your heart has started pounding. Maybe some of you have recognized that as symptoms. That was all due to a stress. It immediately went from your brain down to the adrenals, who sent factors down to start acting on that, to shut this off, to shut the stressor off, to shut this down. And it affected your body in a very physical way. Today, they're under constant stresses from everywhere, and what happens is the adrenal glands physically run out. They do everything they can, but they physically can't make enough cortisol. So what happens? We start getting some conditions, and our next slide will show us that. Here are some of the symptoms associated with low cortisol. And I want you to look, pain in the upper back. I want you to look at low libido, poor memory, headaches, irritability, dry skin, people who have problems with weakness, chronic inflammation. These are just a partial list of the many conditions that individuals can have. They go to their medical doctor, they describe the symptoms. A lot of women, especially in their 40s and 50s, are told they're depressed, they're going through menopause. Not saying that they're not, but a lot of the conditions you have to look at a more global reason. It's not that you're depressed, it's that there's a reason for the depression if you are. So you can have muscle wasting. People say, well, I just can't build muscle. Well, maybe some or all of these conditions, if you have them, are because of low cortisol. Let's go to the next slide. Some of you out there have been diagnosed with these conditions. Fibromyalgia, a very strange unknown condition. You are supposed to have a bunch of tests done and a doctor will tell you, well, yeah, you've got fibromyalgia, but they can't tell you what that is, just that you meet the criteria. Fibromyalgia can be caused by a low cortisol output. PMS. PMS is a real condition. It's not always caused by low cortisol, but it certainly can be. Insomnia. Infertility. How many times have you known someone, a couple who was trying to get pregnant, and they tried and tried and tried, couldn't become pregnant. All of a sudden they went on vacation or they quit trying and boom, they're pregnant. It's stress. It's due to the cortisol or the lack of cortisol. Allergies, osteoporosis. Osteoporosis is a huge problem in our society. Everybody sees the commercials from the pharmaceutical companies. Pop this pill, take this once a month, do the IV injections once a year. Did they ever look at your adrenal glands? Because cortisol affects how those nutrients, calcium and vitamin D and selenium and these other nutrients, are moved into the bone. You could have an acidic blood. That can cause osteoporosis. But the adrenal glands and the lack of cortisol can also cause osteoporosis. How many people have been diagnosed with chronic fatigue syndrome? Chronic fatigue, you're tired all the time. I've got a patient right now, sleeps 20 hours a day. 20 hours, can't hardly function. Figured out that her adrenals were imbalanced, and all of a sudden she's sleeping 6 to 8 hours and she's getting up and she's fine. Urinary fibroids for women who have those. Hypoglycemia, not enough glucose, you're just really tired all the time. What these conditions all have in common is your adrenal glands. I would suggest to you that a lot of medical doctors will write these off as other conditions and want to provide you with a pill, and I'm not saying that they're wrong. What I'm saying, however, is that if you don't have your adrenal glands tested, then how do you know for sure that you're treating the cause of whatever condition you might have? If we go to the next slide, how many of you feel like this? How many of you are in the middle of this picture with all the demands and all of the different things going on in your life? You've got children, you've got husbands, you've got work, you've got all these stresses. And on this side of the screen, you look at all the foods that we have, processed foods, too much sugar, not enough exercise, which was in the last program. All of these stressors add to a constant on of the adrenal glands, a constant burning of the cortisol, and our body simply cannot make enough. So what happens? You get the symptoms, you go to a medical doctor and you get diagnosed with one of the conditions, and your adrenal glands are sitting there and they are basically shot. And we don't know what else we need to do. So what we're going to do now is we've got someone who's sick and they've come down with a variety of conditions. And so what causes them, we're not sure, but we have this dysfunction in the adrenal glands. What are you going to do? If you think your adrenals might be messed up, the first thing to do is find a qualified doctor who will use a scientific objective laboratory testing to determine exactly what stage of adrenal dysfunction you might have. This is typically done by using saliva or spit, and the test that I run requires that you spit into 4 different tubes at 4 different times of the day so that the amount of cortisol that your body is producing throughout the day can be determined. At the same time, I also get a urine sample and run a couple of other tests to look at your sex hormones and other hormones in the body called neurotransmitters. All of these are done in one day in the privacy of your own home. They're sent to a lab and the results come back in about 2 to 3 weeks. Once the test results come in and we know scientifically how your adrenals are functioning, or rather not functioning, it's a relatively simple process to provide your body with the proper supplementation that will provide your body with the hormones it needs while at the same time allowing your adrenals to rest and recuperate. Typically within a few days, the person starts feeling a dramatic change in how they've been feeling. And depending on the symptoms they're having, they may see a resolution of those. Then in 3 to 6 months, supplementation is removed, and generally speaking, the adrenals kick back on and start functioning again on their own. And remarkably, the patient has significant improvement in their entire well-being and better health. So let's take one last break and we'll be right back.
There is a drive, an energy, a momentum that propels us forward, a realization that we need more to get where we're going. That higher education is the pathway to the future. At HCC, we not only get students real-world ready, we transfer them to the college of their dreams and get them on the way to their next success. HCC, smart decision.
I'm Jeremy Call, and I made suction tires. Wait, what? Wait, I used a rivet gun to connect the suction cups, and then I just connected it to the tire. I got the idea from an octopus because of the suction cups, and I don't know.
Anything's possible. Keep thinking. Get started on your invention at inventnow.org.
We received one question from the last show we did on exercise and how it affects your health. Someone writes, I realize that exercise is good for me, but I simply don't have the time. I commute to work, which takes me about 45 minutes each way. Time is a major issue. Well, first I want to compliment anyone who realizes the importance of exercise and wants to find a way to improve their health in this manner. So if you really looked at your schedule and there's no way you can exercise before you go to work or during lunch or even after you get home, then I would recommend a technique called isometrics. You can get a lot of information on isometrics on the internet, but basically it is a method of strength training where you tighten a muscle but do it without joint movement. And if the camera will follow me, you basically flat muscle and you tighten it. And you hold that muscle, that contraction, for a period of 7 to 10 seconds, and then you relax. You can do this in virtually every muscle in the body, and it provides a great workout that will provide a great deal of benefit and contribute to your overall health. And as you can see, you can do it anywhere. Basically, if you're driving, you can do it in your car. Well, this ends this episode of Better Health. I hope you've enjoyed the show. It is my desire to help educate individuals about the variety of conditions and treatment options that exist outside of conventional medicine. I should also state that in no way am I making any type of diagnosis for any condition. All of the comments on the show are for informational purposes only. Any condition that you have or think you might have should be discussed with a qualified healthcare professional. Again, I encourage you to send me any questions you might have regarding today's topics or any other health-related topics that you might have. Just send me an email to hcctv@hccs.edu. And as time permits, I'll answer your questions on air. Until our next show, take care, enjoy life, and live healthy.